Institute, Surgery Center, Vieira, starting a live stream on a patient who traveled here to have the Deuk laser disc repair performed for a cervical disc herniation next to a prior fusion. And we're going to see in a moment on his x-ray, which you can see on his MRI as well at the bottom of the screen, that there is actually a fusion done at C5-C7, and he has what's called adjacent segment disease below. He's also had facet joint pain, which we've just completed the Deuk plasma rhizotomy, left side C6-C7, C7T1 for that facet pain. So this is an example of a patient with two types of neck pain, all in the same area. One comes from the disc, the other comes from the facet. We're going to treat both because we've identified both to be the source of his problem. Now, his prior surgery for his fusion was not done here. When you see the metal plate, I have some criticisms about it, that I would not ever put a plate in that looks like that, okay? Plus, I don't think the surgeon did a very good job of restoring normal alignment at C5-C7. So I'll show you some of the problems. Are you on the x-ray image right now?
Now I am.
All right, can you see the metal plate?
Yep.
Jordan, show the audience the top of the plate. See how the top of the plate, and can you darken the image a little bit? The top of the plate actually lines up with the top of the vertebral body. Can you show them the top of the vertebral body there? Yep. It should never do that because the plate is now encroaching upon the disc space above. So there's the disc space above, and the plate is too close. The plate should end further down, right where the bottom of the screw is. Show them where the bottom, yep. The plate should end right there. The other side of the plate looks okay, which ends halfway down the vertebral body. So that side was good, but the plate is just too long. The surgeon chose too long of a plate, and I would not have chosen that plate. All right, so we're going to work below the fusion. There's a disc down there at number 6-7. We're going to do our best to make it there. We're going to need some inline traction first, and then we're going to need a little shoulder pull with the wrist straps, but give me a little pull that way with the head, slight extension, and let's see what we can do here. And shot. All right, so we're down well far enough. We just need to shot, find the disc space. I could see the needle, and we need an AP view quickly. Let's see where I am. Shot. This is a quick AP. Everybody stay where you are. Lateral. That's perfect. Lateral. So you can see that we're in a good position on the AP view. Pretty close to midline. Shot. I feel the spine quite well. I can see the needle. We're going to go in. Shot. There we go. That should be good. Let me see. Shot. Yeah. Now let's get a quick AP. See where we are. That's perfect, right in the middle. Let's go back to a lateral view. Now there's pretty collapsed in the front here, which is why I'm having a little trouble. Plus there's scar tissue from the prior surgery. But it looks like we're getting into that disc. I'm in. I'm right where I want to be. Shot. Good. Okay, so we got lucky. Everyone relax. Great job, team. You guys did awesome. Yeah, you can get an AP if you'd like. AP means front back. We use the x-ray machine, a special x-ray machine. This x-ray machine is called a fluoroscope, and the one we use is the Siemens fluoroscope. Siemens is made in Germany. There's a big difference between different fluoroscope manufacturers. The less expensive fluoroscopes have very poor quality pictures, which put the patient at risk. You're good, you're good. What's wrong? You see something you don't like? All right. So the better quality fluoroscopes allow us to see details that we want to see, to allow us to fix things in the spine better. And just to give you an idea, the fluoroscope we're using is top of the line. They run about $160,000, $170,000. whereas an x-ray machine you could buy for $10,000. So there's a big difference, and it has to do with the quality and the performance of the equipment. All right, I'm happy. We're in. I feel good. I'm going to do a discogram now. What I'd like to do is give a little inline traction on the head, a little shoulder pull in a moment. Let's get Luis to help with the shoulders. Yep. And we're going to do our discogram. Let's take a look at what we've got. Not bad. Here we go. Shot. Got a little bit in. There we go. So you can see the back there. Show them, everyone relax. Show them the back where the herniation is. Yes. That's it. You can see the dye leaking out. So there's clearly a tear back there. Very good. We're going to go in with our guide wire. Once the guide wire is placed through the needle, we're going to make our incision and then remove the needle. That way we'll have a guide wire with an incision and we'll bring the dilator down. I'm going to do a little injection of some local under the skin just to reduce the amount of pain with the incision as well as no bleeding. The patient is asleep. As a matter of fact, we're looking at the neck on the right side of the neck. The middle of the neck is here, the chest is here, the face is here. There's a tube coming out because the patient's under general anesthesia. All right, let's do our incision. That's a 4mm incision, 4 millimeters. We don't need any bigger. You can see it. We used an 11 blade. Now I need to see the guide wire and make sure I don't pull it out as I'm removing the needle. Let's get a shot. I need a little neck and shoulder, head and shoulder. So, okay, stop. Let's see what we got there. That's perfect, guys. Stay right there. Shot. Okay, guide wire's in far. Taking the needle out, sliding it off the guide wire. Very good. You don't want to accidentally pull your guide wire out when you're taking your needle out. Perfect. There's no bleeding. Dilator. We're fixing one disc. It's the disc below his prior fusion. Again, I didn't do the fusion. I wouldn't have done it this way. Dilator's going down, shot. Perfect. I can feel it sliding just past the esophagus and trachea, shot. We're right on the front of the disc. And let's get a picture from the AP view. Great job, everyone. Any questions from the audience? So for the audience, you're watching a live stream spine surgery from Deuk Spine Institute. You're watching the most advanced spine surgery in the world for disc herniations, degenerative disc, protruding disc, ruptured disc, extruded disc, bulging disc, annular tears. Any of those conditions is what this surgery treats. Now in the past, people have always gotten fusions called ACDF, and you can see that metal plate there. That metal plate is part of the ACDF fusion. We don't do those because we've gone beyond that. There's no reason for metal or fusion anymore. The doctors that are doing fusions are the ones that don't know how to do endoscopic surgery that we're about to do. Or they do artificial discs, they don't know how to do the endoscopic surgery. A little extension and traction. Tell me when you're ready. Okay, so we're going in with the dilator shot. All right, so I'm just starting to go in through the ALL. Perfect, shot. I'm getting some distraction, which is helping me get to the back of the disc, which is where I want to be, shot. All right, beautiful. Almost there, shot. Perfect. A little bit further and we're done. That's it. All right, now, folks, I'm going to ask you guys to pull again in just a moment, but this is the whole surgery is done through this tiny tube. Now this is not a percutaneous procedure. Percutaneous means it's done through the needle, okay? Let me just show you the needle again. This is a needle. If we had put the needle in and we put the laser fiber down the needle, that would be a percutaneous procedure. But we're not doing that because you can't do anything putting the laser down the needle. But here we can actually find the herniation and remove it and debride the annular tear, all using an endoscope. All right, so tube's going down next. Remember, we made a 4mm incision, and the outside of this tube is 4mm, so it should be a nice fit. And I like to twist as I go down, a little irrigation. Yep. All right, feel it sliding past the soft tissues. We're up against the spine. And now we're going to advance the tube through the disc to the back where the herniation is. I'm going to need some traction, everybody, and let's go. Shot? Yep, perfect. Keep going. Almost there. Shot? Beautiful. Wait, stay there. Just 30 more seconds, guys. Shot? Yes. Shot? Yes. Almost done. You can see the disc space is distracting. Stay there, a little more pressure. Done? All right, that's good. We're there. Nice work. So what we've done is we've moved the tube right through the disc to the back. Do we need more distraction?
I need
Let's give a little distraction so we can get the dilator out. On the count of 3, 1, 2, 3. Not too much, not too much. You're not water skiing.
right?
Yeah, good. See? Nice work. Teamwork makes the dream work. All right, perfect. Thank you, Jordan. We are at the back of the C6-C7 disc. Jordan, let's show the audience. Let's go back to the X-ray view and show the audience how we count down to where we are. Jordan's going to bring up the cursor and show you guys how we count for localization. That's what? Show them C2. The top of it looks like a finger. Yep, there you go. Keep going up. Yep, that's C2. Show them C1, the anterior arch of C1, just in front of that. Right, a little further forward, a little up. Right there is the anterior arch of C1. You can see the hollow bone in the middle, that little circle in the middle. Go back there. Go back to C1 and outline a circle there. It's almost like a, yes, that is C1. Okay, and there's a hollow center. Show them the hollow center right there. Yep, that's the diploic bone in the anterior arch of C1. Then you get C2, then C3, 4, 5, 6, and you see that 5 and 6 are fused. So we are at 6, 7. We're going to go in and we're going to repair this disc with the Deuk laser disc repair. When we're done, there won't be any more fusion at this level. There won't be artificial disc. There's no metal put in. And that's why the companies that sell the metal, they hate us because we're not putting metal in people. It's not necessary anymore. But they don't want that getting popular. They want doctors to keep putting metal in patients. That's where they make their billions of dollars a year in profits. We're trying to do what's right for the patient, which is to not put metal in them when it's not necessary. So this patient didn't want metal. Where is he from? New York. He's from New York. We have a lot of patients from all over the world. This patient happens to be from New York. I think he said Long Island, if I remember correctly. Long Island, New York. So we're at the back of the 6-7. There's the tear. There's some bone spurs and grungy herniation right there. We're going to get rid of it. But this is where all of his pain is coming from. Do we have any questions from our audience?
No current questions, but we do have a comment from Liz Lindsay on
hi,
Facebook.
Liz.
And she said, good morning. God bless you all at Duke Spine Institute for giving back one life at a time.
Oh, Liz, thank you so much. And God bless you, Liz. We miss you. I'm glad you don't need our services anymore. And but we certainly miss your positive attitude on life and the generosity of trying to help people that have the same kind of problems as you did. You're leaving your mark, which is great. So just to remind you, we've already done the plasma rhizotomy on this patient before we started the Deuk laser disc repair. We did not live stream it. We're not ready to yet. We will soon and someday. But right now we're not ready to. So we're just showing you the Deuk laser disc repair, which was being done at C6-C7. But this patient is an example of someone with two types of neck pain, both in this one patient. The first type is coming from a herniated or degenerated disc, and the other is coming from the facet joints, which we've already treated. So let's show our audience how herniated discs or degenerated discs, bulging discs cause pain in the neck.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. Yeah, I want someone who can make a fiber optic scope. So call a few companies. All right, hopefully you've enjoyed the video, which shows you why do people get pain in their neck from a herniated disc. And the answer is, it's inflammation, folks, inflammation. Inflammation is the cause of all pain. All chronic pain comes from inflammation. Whether it's a tumor that causes inflammation, or whether it's a herniated disc, whether it's a fracture that won't heal, all of those things cause pain by causing inflammation. And with herniated discs, you can see where the inflammation is. It's in the back of the disc where the tear is. That's what we discovered here at Deuk Spine Institute. Many years ago, we've published the annular debridement, which is to clean out the inflamed tear and get rid of the inflammation. Let's show the audience how the Deuk laser disc repair gets rid of the inflammation by debriding the annular tear. And it's unique surgery because no one else does this. And the annular debridement part is unique to the Deuk laser disc repair. It was published as part of our surgery 10 years ago in 2012. And we've been teaching it for 10 years now, how to do this procedure to other surgeons. So I think there are surgeons that are doing it now around the world. I've talked to surgeons from India and China who like the Deuk laser disc repair and are performing it in their countries. Unfortunately, the United States, we don't have any other surgeons necessarily performing it that I'm aware of. But like I said, someday it will be this will be the only thing surgeons do because their patients will demand it. And maybe even the insurance companies will get smart and demand it.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. the laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Yes, welcome back. Hopefully you understand now how the Deuk laser disc repair works. We are out in the foramen. This is all scar tissue from chronic inflammation on the patient's left foramen at C6-C7. And I've been blasting the scar tissue and herniations away with the laser. And now we're coming back to his right side. All of this stuff is tremendously degenerated. This is a very degenerated disc. And what I mean by that is the disc is collapsed and full of chronic inflammatory tissue. That's what a degenerated disc is. It's one that has a lot of inflammation tissue in it. This, for example, is the posterior longitudinal ligament with scar tissue embedded in it from chronic inflammation. This solid wall right here is chronic inflammatory scar tissue. It's all collagen and calcium. That's what the gold stuff is. Okay? It's just thick scar tissue from literally years of inflammation from this herniated disc. This is what we can avoid having when patients get the Deuk laser disc repair. The inflammation will stop. And when it stops, the degenerative disc disease will stop. Their disc can be preserved. That's why if you have a herniated disc or bulging disc, get your Deuk laser disc repair done sooner than later and avoid degeneration of your disc. Once again, Deuk laser disc repair is the only surgery in the world that does this. Everyone else is doing artificial disc fusing, doing laminectomies, doing foraminotomies, none of which are going to stop the degeneration of the disc. All right, just about done. I need 3 minutes and we're done. Dr. Berndes, you knew that we were going to be done quick, right? Huh? Okay, yeah, good. Yeah, we're just done here.
We have a question.
I'll take the question.
This comes from Khaled on YouTube.
Yes.
And they asked, great job. Does Professor Deuk accept visitation for 2 to 4 weeks? I am an orthopedic surgeon from Jordan.
Orthopedic surgeon from Jordan. Yes, I would accept visitation. If you're interested in visiting as a visiting surgeon, just contact me. The best way to do it is through my email. You can go ahead and post my email. It's my last name, deukmajan@gmail.com. Please don't sign me up for any funny websites. But go ahead and put my last name, deukmajan@gmail.com. Feel free to reach out to me by email. And we'll see what we can arrange. All right, so we are just about done. We're going to be taking this tube out. We've just put in some antiseptic. And you can see that this surgery is very quick. And there's no need for post-operative narcotic painkillers, like with fusions or artificial discs. There's no need for implants, metal implants. Here, if you want to take that. Metal implants are only necessary when the surgeon removes the entire disc in the front. And there's no need to remove the entire disc at all. Okay? In the old days, we had to remove the entire disc in the front of the herniation because we had no way to get to the herniation unless we took the whole disc out. We weren't able to see with our eyes or the microscope to the back of the disc. But endoscopic surgery has changed that. It allows us to pass through the disc to get to the herniation and tear in the back of the disc and only treat the herniation and tear in the back of the disc without damaging the front of the disc. So by leaving the disc and not taking it out during surgery, the patient doesn't need the patient. Can you see the incision?
Yes.
The patient does not need a fusion or metal. Okay, so it's 4 millimeter incision. It's a Band-Aid. We're done. There's no metal. There's no fusion. There's no post-operative painkillers. It's just Tylenol for one night and an anti-inflammatory. One night. Done. All right, I'm going to come answer questions, so type them up. I'll be happy to take your questions and answer them face to face. Why don't we show the viewers the difference between a Deuk laser disc repair and a fusion, cervical fusion.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a ½ inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, A spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's half-inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Dr. Deuk here, and welcome to our broadcast. We have just completed performing spine surgery on the cervical spine, which is located in the neck, on a patient who traveled from New York to Florida for the procedure to be done. And I just want to show you this little model here that I have. It actually shows the, let me grab a little pen here. It shows that there's a metal plate attached to the spine. That's like this patient had, a metal plate attached to the spine. The way the plate is attached is through screws, and these screws get drilled right into the bone and screwed in, and it holds the plate onto the bone. It's typically 2 screws per bone. You could see the bone is called the vertebral body, and my criticism in this case was that the surgeon who put the plate in put too big of a plate in, because the top of the plate was not at mid-vertebral body, but it was actually sitting way up here right below the disc, and that's going to cause the upper disc possibly to wear out faster. But in this case, the patient's lower disc was a problem, and I went in just below that plate, went through the disc, leaving the front of the disc alone, to the back, where we removed the herniation and the source of chronic inflammation, which is the annular tear, with the interposed nucleus pulposus. The surgery went quite well. Now, before this happened, we actually had the patient upside down, facing down, and I did what's called a Deuk plasma rhizotomy. It's a new technology that we developed here at Deuk Spine. I developed it to basically treat facet joint pain. Now, people with facet joint pain, they have a characteristic pain in their neck. It's on one side or the other, or both, and we call lateralized. And it's typically about 2 finger breadths from the middle of the neck. So if this is the middle, you put 2 finger breadths. If the pain is off to the side there, 2 finger breadths over, it's typically facet pain. Another characteristic of facet pain is it hurts to twist your head to the side. and it's always to the side of the painful facet. So if it hurts my left base of my neck here, and I turn my head to the left and it hurts to go, and I can't go any further because the pain is severe, I tell the patients to put their finger exactly where they feel the worst pain. They're going to be pointing right at the facet joint that's painful. And then I know to go in there and repair those facet joints with the plasma rhizotomy that we developed at Deuk Spine. It's a quick procedure. It takes about 15 minutes, and it's outpatient, along with the Deuk laser disc repair. Now, most patients don't come here with facet joint pain. They come with disc problems. So we're typically doing disc surgery through the front of the neck like we just did, but we also treat facet joint problems if we know they exist. We don't want to leave the patients in pain. All right, do we have any questions from our audience? Well, I hope you enjoyed the surgery, and to the orthopedic surgeon in Jordan, send me an email. I'd be happy to talk to you about coming out and spending a few weeks here at Deuk Spine.